Dr. Toney KiSS series, high blood pressure. Why am I in a gym telling you about high blood pressure? I'm in a gym because I want to teach you something about high blood pressure that can perhaps help you. High blood pressure. In conjunction with what your doctor is doing for you, you can also do this for yourself and potentially eliminate the need for what your doctor is doing for you to bring that pressure down. This is an adjunct to the treatment you're already receiving for high blood pressure. If you can understand high blood pressure, why it happens, then you could better understand what it takes to get that process reversed. Now, there are exceptions to what we're talking about. There are exceptions is if you have cancer on your kidneys or something, a different type of high blood pressure. Most high blood pressure, this falls into this category of what we're talking about here. But if you understand the mechanism, how it works, you can understand how, again, to reverse it or stop the process of the high blood pressure getting worse. This is physiology. It's very simple. Our heart is a pump. And essentially, there's a pipe going into the pump and a pipe going out of the pump. Understand this concept. Our pipes are only so big. So people say, well, I have plaqued arteries, so therefore I can never change my high blood pressure. That's not true. Here's why. Because these vessels go all over the body. This piping, this plumbing goes all over the whole body. If we do resistance exercise, that's lifting weights, that's using resistance machines, resistance bands, stuff that's actually going to cause the muscles to work in your legs, in your chest, in your arms, your back, in your stomach, everywhere. These muscles, when they are worked that way through weight training or resistance training, it requires more oxygen getting to those muscles and more nutrients, food, sugar, etc. In order to do that, the vessels have to increase their size. And so if I increase my size, essentially what I'm doing is I'm dropping down the pressure inside the actual vessel itself or inside the cardiovascular system. I didn't change the volume. I changed the size of the container. So therefore the pressure drops down. So lifting weights, resistance exercise is very effective in dropping high blood pressure to the point that you may not need your medications for high blood pressure. Always consult your physician. He'll be the one to evaluate whether or not you need the medications or not. I'm giving you an alternative to or an adjunct to the treatment you're already receiving. High blood pressure, it could be avoided and it could be beat. Resistance exercise, Dr. Toney KiSS series.